Living with a stimulator requires a commitment from you to be mindful of it in your movements, to maintain it, and to use it as part of an overall pain management strategy.
A person who has a spinal cord stimulator does have some changes in their lifestyle.
And one of the concerns that people have with a spinal cord stimulator is that there's certain activities that we still have to be careful of because I could put the device at risk for migration, and that's when the lead moves.
Patients always need to be conscious of the fact that they have a stimulator in place. So yes, there are certain activity restrictions that they will have.
Examples are golfing, examples are bowling, and so make sure you understand before you do those activities what the risks are. If you decide to do those activities, make sure you've discussed it with your healthcare provider, and make sure you understand the activities that you can do to restrict that risk.
I can't go skiing in case I fall or anything.
Activity restrictions will be things like jerking motions. Patients who are involved in maybe a job that requires excessive heavy lifting would not be able to perform that task anymore.
You can't lift real heavy objects. You can't bend over straight to the floor, and you can't reach right straight up over your head. So not many limitations.
Sports like tennis or golf where twisting and jerky motions occur are not encouraged for the patients to complete. And one of the things when I am doing some counseling with patients about thinking about going ahead with spinal cord stimulation is we talk about what activities they enjoy in life now.
Well, the activities, I can't do any strenuous activities. I can't shovel snow and a lot of the other activities, wrestling with my grandkids or anything like that. So same thing with going to a park maybe and riding fast rides and jarring rides.
I go out walking with my husband. We can go, to a party, throw horseshoes, go fishing.
In regards to a normal sexual relationship with your significant other, in view of having an indwelling spinal cord stimulator, absolutely you can. It does not preclude sexual relationships with your significant other. And in many instances, chronic pain precludes someone from having those. And once we have their pain under reasonable control, they can resume a healthy sexual relationship.
I think it worked out real well. Yes, I'm limited to some of the strenuous things I have to do, but there's a lot of stuff now that I can do that I couldn't do before with the pain that I had. When I go through the airport, I can't go through the regular metal detector. I have to tell them I have a stimulator and I have a card that shows them that I have it in my back. So what they do is they pull me on the side and they raise my hands and they hand search me. So they check it that way instead of by machine.
I just recently did travel by air, and yes, you do have a card like a person that has a pacemaker put in, and you show them your card. This last time I showed them my card, but I still had to go through the scanner. But that's fine. I mean, that's the way it is today in today's world. So, but that was the only problem I've ever had. I've never set off any alarms or anything like that.
When you have an implantable device, there's certain tests that you may have to go for. Maybe not even having to deal with your painful condition, but other medical tests. It's important that you check with your implanting physician to make sure it's safe to go forward with those tests prior to doing them.
With an implant, there are some medical treatments that we need to guide the patient. Of the top priority would be an MRI.
Only one company makes a device that's safe for an MRI, and that is only for a head MRI.
It's important when you have an implantable device that you carry some form of identification, letting others know that you have an implantable device. For example, for some reason you were found unconscious, it's important for us to know as healthcare providers that you may have an intrathecal device or a spinal cord stimulator.